Hello, everyone. Great to be here with my friend and colleague, Dr. Jerome Hester. Going through dental school and orthodontic residency, I realized the importance of working with dental specialists like oral surgeons and endodontists and periodontists, but didn't realize the importance of working with an ear, nose, and throat specialist. And luckily, I found Dr. Hester, and he's going to be joining us at the forum. So maybe, Dr. Hester, you can share our relationship, how it works, patients back and forth, and how many cases we've co-treated.
Thanks a lot, Eric. I felt throughout my career that truly the dental and orthodontic community were really the front line in many times in evaluating these patients and diagnosing some of these issues that we have with the airway. And I think in our time together working, you've done a great job of understanding the airway, its impact not only on the things you do, but also on the patient's quality of life. And through that evaluation and subsequent referral, we're then able to take those patients and discuss with them options for improving their airway that not only improves the issues that they're having with quality of life, but also I think sometimes makes the orthodontic treatment more successful.
We found that we're able to develop the midface with different types of expansion and improve nasal dimensions. And then you can come along and you can improve nasal function by very specific and oftentimes minimally invasive procedures.
Exactly right. In the past, some of the nasal procedures that were done were almost actually destructive. In today's world, many times we can treat these issues after complete evaluation in truly minimally invasive techniques that allow the patient to return to normal function almost immediately, but still get us the results that we want in comprehensive improvement in the nasal anatomy and function.
Can't wait to hear your presentation in October. I'm looking forward to learning from you as always, and hope that all you out there can join us. Thanks so much.